Hey Bethany, I'm Corey. I'll be your nurse today. I'm gonna do a quick assessment on you. Could you stick your arms out for me? I'm gonna assess your arms. I'm gonna make sure that their size is appropriate, they're symmetrical to one another. You don't have any edema. Could you roll your arms over for me? I'm gonna look for the natural formed venous patterns in your arms. I'm gonna look at the color, make sure it's appropriate for the rest of your body. Very good. Could you stick your legs out for me? I'm gonna look at the same thing, size, symmetry. I'm gonna look at the skin, any rashes, lesions, edema. I'm gonna look for the natural venous patterns and make sure the color is appropriate for your body. I'm gonna come through and I'm gonna palpate your arms. I'm gonna palpate for temperature, make sure it's appropriate for your natural body temperature. I'm gonna come in here and I'm gonna feel your brachial pulse. These two fingers for 60 seconds. I'm gonna come down here, I'm gonna feel your radial pulse with these two fingers for 60 seconds. Come over here, do the same thing. And the radial pulse, I feel just a +2 grade is what we would call it. It's good, it's not throbbing and pounding. It's just a normal biphasic. Come down here and I'm gonna feel your legs. Okay, I'm gonna come into your femoral. Come right here, feel your femoral pulse. I'm gonna come here, I'm gonna feel the popliteal. My fingers right behind the kneecap pretty well, and the posterior tibial, and the dorsal pedis. Very good. I'll do the same thing over here. Femoral, posterior tibial, as you were, popliteal. Two fingers directly behind there. Come here, do the posterior tibial and the dorsal pedis. There we go. All right, and those are +2. That's how we would grade those pulses. Pretty normal. Very good, very good. I also need to assess. There's no, palpable edema. There was no palpable edema on there. Okay. Now, can I have you keep your shoulders back, head up, chin up? I'm gonna look at your head. I'm gonna look for the hair distribution. See how kempt the hair is, the color of the hair. I'm gonna look at your scalp and your face, the skin on your face. I'm looking for any rashes, lesions, blemishes. I'm gonna come to the side. I'm gonna look at the contour of your skull back here. Just make sure it's pretty much just rounded and the way it needs to be. I'm gonna look at the symmetry of your face too. Can you smile for me? Could you show me your teeth? Could you pucker your lips? And could you raise your eyebrows? I'm gonna use the points of your chin, nose, and eyebrows to assess the symmetry of your face. I'm going to take a closer look. Now I'm going to localize in on your eyes, okay? I'm going to look at the external eye out here. I'm going to look for any breakdown, look at the eyelashes, the eyelids, look for lesions, redness. Take a look at the eyebrows, raise your eyebrows again, test that symmetry, see how kempt they are, any lesions, rashes. I'm going to come in here and look at the conjunctiva right here in the eyes, this little pink part in here is the conjunctiva. I'm gonna look for like drainage. I'm gonna look for swelling, redness, anything like that. I'm gonna look at her pupils, as you were. I'm gonna look at her sclera. Come in here and I'm gonna see, is there any yellow, indicating that there may be possible jaundice, is there any redness, any abnormalities there, and they're not, they're clear, white, moist. I'm gonna come through and look at her pupils. Her pupils are about 3 millimeters, rounded, eye movements brisk. They're round pupils, it's good. I'm gonna come through and I'm gonna test her pupil direct reaction, which means I'm gonna take this light, I'm gonna shine it in her anatomical left eye. With that, I'm gonna watch that anatomical left eye constrict. And it does, it constricts. I'm gonna come over here and test the direct reaction of the anatomical right eye, Shine light into the right eye, watch it constrict, and the right eye does constrict. Now I'm going to test the pupil consensual reaction. What that's going to do is I'm going to shine this light into her anatomical left eye, but my eyes, I'm going to be watching her anatomical right eye to ensure that anatomical right eye constricts when the light goes into the anatomical left eye. Light is in the anatomical left eye, my gaze is on her anatomical right eye, and I'm watching that pupil constrict with the light going in this eye. I'm going to do the same exact philosophy over here. I'm going to share where I'm going to shine the light into this anatomical right eye. I'm going to watch the anatomical left eye constrict, testing the pupil consensual reaction. I'm going to look at her ears. I'm going to look at the auricle of her ears. I'm going to look for any drainage, abnormalities. I'm going to make sure they're intact. I'm going to come through, make her symmetrical with her head. And then I'm going to come through and look at her nose. I'm going to look at the color, shape, consistency of her nose. I want to look at the external nose first. The nose is intact, no external drainage. I'm going to come through and look at the nasal mucosa. Her mucosa, there's no inflammation, no redness, it's pink, moist. The membranes are moist. I'm going to look at the septum externally. It's attached externally and even internally. I take a look at the septum and make sure there's no deviation or occlusions in there, and the septum's intact and symmetrical. Your nares are symmetrical, your nasal cavity is symmetrical. I'm going to come through and palpate your sinuses. I'm going to start with the frontal sinus. I'm going to take my thumbs. I'm going to come up here above the eyebrows, apply some pressure. Do you feel any pain?
No.
Okay, I'm going to come down here to the zygomatic arch with my thumbs. I'm going to apply a little pressure and test the maxillary sinuses. Up here where the frontal, and this is the maxillary. Do you feel any pain?
No.
All right. The slight pressure, that's how you test the maxillary and frontal sinuses. Okay, now my next step is I'm going to inspect her mouth. Where's my pen light? There it is. All right, so first I'm going to look on the external lips for any bruises, blisters, ulcers, or sores. I'm going to have her open her mouth. I'm going to look at the oral mucosa. It's pink, moist, intact. I'm going to look at the roof of her mouth. I'm going to look at her teeth, her gums. I'm going to look at the floor of her mouth, lift your tongue. I'm going to depress her tongue and take a look at the pharynx. Her tongue's depressed. I'm going to look at her pharynx. There's no redness, drainage of the pharynx. I'm going to come through and I'm going to inspect her neck. Her neck's supple. It looks symmetrical. I'm going to take a look at her trachea and her thyroid. I don't see any deviations or swelling. I'm going to come here and palpate for thyroid, just like this. 2 fingers, 1 thumb. Thyroid is unpalpable. I'm going to come here to the sternal notch, and I'm going to assess the trachea using that midpoint, and I don't see any deviation there. And now I'm going to go through and I'm going to palpate her lymph nodes. Time. Where am I on time?
Mm-hmm.
1 minute. All right, I'm going to go into her preauricle lymph nodes, postaurical lymph nodes, her occipital lymph nodes, her tonsillar lymph nodes, her submandibular lymph nodes, her submental lymph nodes. Here. I'm going to come through into the superficial cervical, which will be up here. I'm going to come down to the posterior cervical. This is a little triad, the triad of the deep cervical chain. I'm going to go to the supraclavicular, which is down here, and the epitrochlear lymph node. I can come here with my fingers like this, and I can feel the node here. I'm feeling for any swelling, pain. That's what I'd be feeling for in these nodes. I would do that bilaterally, and then I just come over here, feel the same landmarks, and then I can feel the epitrochlear.
Okay.